When Health Education East of England launched applications for the Improvement Leaders Collaborative, we thought here in CCS it would be a fantastic opportunity for our Luton system to continue with the great work they're doing within the Better Together programme. We are leading the rollout of the integrated teams across the Luton system, which involves working with our health and social care partners. And actually the key thing that's going to be the nugget that's going to make the difference is developing strong system-wide relationships. We had 6 individuals working from all of the different health and social care organisations who have now spent the last 6 to 9 months really focusing on how can we make our integrated teams the best that they can be.
I'm Gail Robinson. I've been part of the Better Together initiative in Luton, and we've been focusing on the 4 GP clusters and Better Together. And we've worked on a project to really support frail elderly in the community, and the idea behind that is to support them in their own homes and try and cut down on the visits to the Luton and Dunstable Hospital. The process has been going on for over a year now. We've got it all in place. We're now evaluating the service, so we're doing really, really well. Everyone's working really well together. It's very exciting.
Hello, my name's Anne Adams and I work for Virgin Care in the area of intermediate care in Luton. I was really very energised and thrilled to be asked to be part of the collaborative when I first heard about it and heard about the other people who are going to be involved. The material that was delivered in all the different sessions, in the online sessions, was excellent, very stimulating, top quality, and I was reviewing my notes this morning and just came up with some real reminders of some key things. It's good to keep going back to the notes, reminding yourself, because it was very energising and stimulating. Then you get back to the day job and it kind of sinks down again. And so to go back and review the material, I feel energised again today.
Clearly, we were identified as senior managers who could build on current working relationships to ensure that the integration, health and social care integration agenda within Luton was progressed at the appropriate pace to support the delivery of the Better Together programme. What did I get out of it? Opportunity to work more closely with colleagues within Luton and to be part of a change, a whole system change, being able to take part in the webinars, the study sessions, to focus on things that impact on change, understanding we all have different learning styles and personality types, and just kind of refreshing on those models, which was really, really helpful, and also working with my colleagues, understanding their learning styles and also our motivations for change.
Paul Lindos, I'm the Assistant Director Primary Care Development for Luton CCG. I must say, I think for me the biggest benefit of this programme project has been building relationships with other senior members across different organisations. And that for me has really been the thing, the takeaway piece. So we've had a chance to have a bit of a headspace, sit down, look at issues and problems together. Within the group there was a vast array of experience, and some people have been around the Luton system for a long time, so had a lot of history around the patient pathways and how they've been made up over the years.
We've been able to develop our integrated crisis response model here in Luton by building on the winter crisis response pilot. We held a local rapid improvement event, and since then we've had a really successful workshop with our clinicians where they had the opportunity to meet with each other, talk to each other about their challenges, about their ideas for how things can improve and how they can work together, so that patients feel that their care is coordinated, there's less duplication, and that essentially when crisis happens that they feel that the care around them supports them to stay at home. The next steps in our plans are to work more closely now with our GP clusters so that we can continue using PDSA cycle approach to develop and refine the pathways, so that again we're learning all the time about what are those things that are going to make that service a success.
We have learnt so much, and one of the things that I'm excited about is being able to share that knowledge with my staff teams and be able to move services forward. We have one specific project at the moment, but I'm already looking at other things we can move forward in an integrated way with some of the colleagues that I've worked with within the collaborative, because I really think this is a start of something new and exciting for the people of Luton.